Okay, hi, this is Paul Slatkus. We're going to talk about March is Anal Cancer Awareness Month, and this is any cancer is quite serious and it can be deadly. And so the more we know about treatments, and we have Lillian Krepel. Hi, good morning. Hi, how are you?
Hi, good morning.
Executive Director and co-founder of the HPV Cancers Alliance, and colorectal and anal cancer specialist, Dr. Paul Romiser. I'm sorry. How do I pronounce your last name?
Uh, Good to see you, Paul. Paul Romiser here.
Romiser. Okay, all righty. Okay, well, I just got a colonoscopy. I don't know if that helps.
Perfect.
It's good. It was a good idea. I've gotten a few of them.
Very good idea. Very good idea.
I
I
also,
hope it went well.
yes, so far so good. And I took the pills instead of drinking the liquid. Something new out there, and I didn't have to drink the liquid. But I know if you drink
It's
the
not that bad, right?
oh,
It's not that bad anymore.
the pills worked. All right, but when I drank the liquid, I had a lemon. Every sip of that gorgeous stuff. I put vodka in it. Was that wrong? Also,
Well, if you got the job done, Paul, I think that's what matters.
we like doctors like you. All right, so anal cancer is actually quite a serious issue. And how does somebody get anal cancer?
Yeah, that's a really good question. So, anal cancer is related to something called the human papilloma virus, or HPV. About 90% of all anal cancers are associated with this virus. And HPV is really common. In fact, of people who are sexually active, the vast majority of them have likely been infected with HPV at some point in their life. And normally what happens is our immune system, our healthy immune system, will fight and target this HPV virus and eliminate it from our body. But in some patients, the immune system fails to do that. So in 2024, we saw about 10,000 cases of anal cancer diagnosed in the United States. And certainly it's rare, Paul, but it's on the rise. Cases are rising. And that's why we're here today, because we want to bring awareness to this cancer. And we're really grateful to be here.
So, so how, I mean, is it through anal sex? How do you get this?
Yeah, another great question. So there's certain risk factors that we know are associated with HPV and with getting anal cancer. So an infection of HPV is certainly going to put you at increased risk. Having a compromised or suppressed immune system will put you at increased risk. Things like HIV or being on certain medications. Tobacco smoking is associated with increased risk of anal cancer, and receptive anal intercourse is also associated with it. And of course, there's going to be people who've had prior HPV cancers, things like cervical cancer, and they'll be at an increased risk as well. And it's important to note because some of these people who are at increased risk may benefit from screenings. And so, part of this is this awareness, and the screening is important because, what we're going to hear is that some of the symptoms of anal cancer can mimic things that happen normally every day to all of us. Things like hemorrhoids, right? So symptoms would be things like a mass in the anus, pain, itching, bleeding, or a change in your stools and how they look, the size, the shape, the frequency. And some of these are they're a little bit taboo, or they might be embarrassing for us to talk to our doctors about. And I get that, but I think it's really important that people hear that the doctors want to hear if you're worried about something. They want to make sure you're okay. They want to help you. And trust me, they'd rather hear from you than not hear from you down the line, and everyone learns to regret it.
I'm going to ask you one other question, then we'll get to the alliance, because I don't know the answer to this. And um, duty, I'll use the word. I was told one time that if you ate that, you could die. So it would seem to me if a man's this is serious. This you're saying, I mean, when I talk to a doctor, I talk serious stuff. If a man has sex and he gets, I'm going to use the word duty, on his a penis, it go into his body, and is that a way that somebody could get a cancer?
Yeah, Paul, that's a great question. I mean, it's not really, spread, I'd say, through stool or duty, as you're saying, but it's really spread through skin to skin contact. So,
Oh,
I mean, what we're thinking of is really the way it's transmitted, this virus. It could be through, essentially simple things that you do intimately with another person. It doesn't necessarily need to be due through duty. And there's a lot of people out there who've never had receptive anal intercourse and they still have anal cancer. So it's really, I think, more about the skin to skin contact.
okay. All right. Well, thank you for that information. I imagine there might, if I think about it, probably somebody else wonders. I hope. I'm the audience. But there's an alliance. Tell us about your alliance, please.
Hi, Paul. Thank you. Um, yeah, so I actually was diagnosed with HPV related cancer 7 years ago. I also experienced the signs, which were itching, bleeding, and a little bit of pain. And I got diagnosed with stage 2 anal cancer. After I was finished, as I was going through treatment, I thought we really have to do something about this because this is the most common virus. People are walking around with it. They have no idea that, you know, women don't know why they're going to get pap tests and so on and so forth. So we created the HPV Cancers Alliance along with two other people. And we create education and awareness in an effort to save lives. And today we're doing what we're doing. We're partnering with Insight to raise awareness about this awful disease.
Uh-huh. Does Insight have some help here? I'm pro pharma. I'm pro people that go into trials with pharma.
Yeah.
They're heroes to me. So is there something out there that's good to be considered to be used?
Well, I think Paul, Insight as a company has put a lot of effort into not only raising awareness for anal cancer, but also into developing new treatments. And I think that that's really important and special because this is a rare cancer, and sometimes it doesn't get the attention that it deserves. But it's a curable cancer, and that's why we're here. We want to raise awareness. We want people to understand the risk factors so we can catch it early and we can, cure more people of this.
All right, you said a big word there, curable. It's curable. So first of all, so if if I'm itching and I got some pain, I should be going to the doctor and saying I got some itching and I got some pain. Do you have to go to, is it a proctologist or do you go to your, the gentleman who gave me my colonoscopy? Who do you go to when you have this? What's the routine? What should you do?
So So, Paul, I actually went straight to my gynecologist, but it was missed, unfortunately. But you know your body more than anybody else. So I pressed on and I went to my gastroenterologist,
Yeah.
and he found it through doing a digital anal rectal exam. He palpated and he found the lump, which was not found, which wasn't, the GYN didn't find it. So to answer your question, a woman can go to the gynecologist or a primary care, and or a gynecologist, a gastroenterologist. And for a male, I would say primary and or gastroenterologist, and I guess proctologist. I'm not 100% sure about.
Yeah, and I'll say this is something that, doesn't need a colonoscopy up front to know that there's something that needs to be looked into and further investigated. So, you know, go to the doctor you trust most at the beginning and they will guide you. I promise that. And, it's something that they can do an exam in the office to see if there's something abnormal. And if there's abnormal, they can help make sure that you see the right people for you, because everyone's different. Everyone's insurance is a little bit different. And we just want to make sure that people with symptoms are getting out there and talking to their doctor about it.
And so what do they actually look for? So say it's an office visit and you're at the gastroenterologist. What are they looking for? Bumps? Are they looking for, what are they looking to give them some hint that there's real concern here?
Yeah, as Lillian mentioned, they're going to do this digital anal rectal examination, which is just essentially feeling the anal canal with their finger. And so I know it sounds scary, but it'll be a relatively painless and well-tolerated procedure, but they can go in and feel for any abnormal masses or lesions, see if there's any blood on the examination finger, see if there's anything external that they can see. And again, all that can be done in the office. It doesn't require any sedation, any preparation, anything like that. It's a real quick and easy procedure.
Let me ask you another quick question. In the old days, you go to the doctor, regularly my doctor, and he'd take his finger and he'd go boom, 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 bang, right up there. Was that what was he looking for? Besides the situation with me going to that doctor to do that. What was he was he looking for this cancer? I don't know what he was doing.
Yeah, I mean, every situation's different. Every patient's different. You know, I don't want to speak for that physician, but I'll say that I'm sure they were looking for something or they had a reason for it. But, you know, we're here. We want to reduce the stigma. We want to empower everyone to get out, raise awareness. And Paul, we want to thank you for having us today. Analcancer.com is where your viewers can go for more information. And Lou and I are really grateful to be here today.
Yeah,
Thank you for doing this. We appreciate it. Thank you.
Thank you.